Let's actually get to know what happens once kidneys fail. It's very simple to speak that there is a kidney failure. The biggest problem in kidney failure is it would not be easy to identify kidney failure until both the kidneys fail totally. The reason is that one human being would be sufficient for half a kidney to sustain his sedentary life. So in that cases, when both kidneys totally fail, then only we will be able to identify. The general symptoms would be swelling in the legs, feeling weak, loss of muscle and weakness, because kidney are the very important organs which actually create blood in the body. Hormone called erythropoietin, which actually stimulates the bone marrow to produce blood cells. So whenever there is a kidney failure, there is a decrease in the blood in the body. The other most important thing which people should know is who are diabetics. People who are diabetics slowly think that their diabetes is going away. My sugars are improving, my sugars are becoming better. I am having low sugars with the tablets. The reason is that the kidneys are probably failing. That is extremely important because kidneys are the ones which actually metabolize insulin. So when the kidneys fail, the insulin will be more in the body and the patients become hypoglycemic or they have symptoms of low sugar. Now comes the role when we should be looking at and whom we should be seeing, which doctor we should be seeing. 80% of the patients with kidney failure are liable to be having a reversible failure. Only 20% have irreversible failure. And most of the time when there is a reversible component, it is the urologist who would be able to take care of it, because when there is a swelling of both the kidneys or there is an infection in the kidney, or there is in males when there is a prostate which is causing back pressure changes onto the kidneys. So most of these reversible causes are reversed by a simple endoscopic or a laparoscopic or robotic surgeries, or in case of certain diseases by medications by the urologist. When both the kidneys are irreversibly failing, at the end of the day you need dialysis. That's where a nephrologist comes into play. Apart from that, when there is significant hypertension and there are autoimmune diseases of the kidney, or when there is no swelling of the kidney and then slowly they are failing because of either BP or sugar, that is where the nephrologists come into play. So essentially 80% of that can be reversed. To what extent, it depends on the what level of renal failure or kidney failure that particular patient has. But then they all can be treated. In case where there is an irreversible renal failure, we will be able to do a robotic transplants with very small cuts, and these patients would just walk off the bed in about 48 hours. Thank you very much.
Like, comment and subscribe for more health updates.